Is everyone good to go? Everyone good to go? The mic is up loud enough? Check, 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 mic check, mic check. 1, 2, 3, 1, 2, 3. All right, we'll be starting in just a few minutes. How are you? Yes. I have my glasses in there, but that's okay. I'm close enough. Good afternoon, and thank you all so much for being here. As you know, we are here at the Ernest Memorial Convention Center, Hall B, where we've set up a resource center for all of our evacuees that we're hosting in the city of New Orleans at this time. I'm joined this afternoon by our Director of Homeland Security, Mr. Colin Arnold. In addition, here with us is our Director of the Health Department, Dr. Jennifer Avegno. Both have been central to the operations and in the response to Hurricane Laura and the impacts that it's had on the city of New Orleans by way of the evacuees that we're caring for constantly. And we're welcoming them with open arms, and we're really pleased that we're able to provide quality service at this time. And it's all that we strive to do every single day for our people. This operation has been one that has been all hands on deck as it relates to the city of New Orleans and us communicating effectively with the state of Louisiana leadership to ensure that we have the necessary resources, again, to deliver quality service to our evacuees while they are here in the city of New Orleans. Currently, we have over 9,565 evacuees in our city, occupying a total of 33 hotels. The evacuees, in terms of our capacity in the city of New Orleans, we have met that capacity, and all evacuees in other parishes will be sent to Alexandria for proper sheltering and care. This information can also be found by dialing 211. We are in close communication, of course, and contact with the Louisiana Department of Children and Family Services, who are partnering with, of course, on the ground with our city, again, to deliver quality services to our evacuees while they are with us. You know, one of the things that we're so proud of is, one, having this centralized location where our people can get their needs met, even as it relates to behavioral health services. And even our mothers who are currently expecting have been able to secure vital resources and services. Of course, the Louisiana National Guard remains on the ground with us and a part of our unified command. You'll hear more about this from Colin Arnold. I do need to say that, as I've been talking with and collaborating with Mayor Hunter through this whole epidemic, really that started, we know, Thursday, but on Friday, hitting the ground here in the city of New Orleans with our evacuees. I must say and must communicate this to the residents of Lake Charles. Your mayor has been in constant communication with me and with the Unified Command here in the city of New Orleans, and he is very thankful and grateful to the support that the city is providing, and absolutely we are happy to be in partnership with our mayor of Lake Charles, and we'll continue to work together in this. One of his main concerns on the front end was the ability for his families to be reunited with their loved ones. And so as a result of very much hard work on the ground, including my administration, the DCFS team has set up a hotline, and the number is 225-342-2727. This is the reunification hotline that is currently in place. The Orleans Parish Communications District, EMS, and the New Orleans Fire Department have been responding to calls since over the weekend. That also includes our New Orleans Police Department that has been boots on the ground in partnership with the Louisiana State Police. We've provided medical and emergency responses for evacuees. EMS responded to 50 calls from August the 28th through the 30th, but as of now, there are an additional 22 calls that we've responded to, making it a total of 72 calls. This is the utilization of, again, the New Orleans Fire Department and our EMS team, who are a part of the Louisiana Task Force 1, and also has provided 6 boats together that were deployed to Southwest Louisiana. The office of the Orleans Parish Communications District, that's our 911, our 311 center, has been again activated to help with telecommunication services for our evacuees and parishes around. 911 system, it remains operational and effective during, of course, this event and any that will come. What we continue to be concerned about in the city of New Orleans, and I have to state that, is one, wanting to ensure that we're able to consistently meet the needs of our evacuees every single day and every step of the way. We are prepared for the long haul, given the conditions that we know are on the ground in our affected parishes due to Hurricane Laura. However, I'm making sure that I'm advocating and ensuring that this city gets her fair share of not only responding to the needs, but of course being made whole as it relates to the resources that we're deploying from city government. It's important. In addition to continuing to be going through the pandemic of COVID-19 and the diluted and redirected CARES Act money that the state did receive, particularly for municipalities, that again has been diverted and diluted, which is causing a real strain on the operations of the city of New Orleans day to day. Currently, we've only received tranche 1 through the CARES Act, which was about $43 million after submitting expenses of over $49 million. Our second tranche, which was submitted, over $41 million. We have yet to receive any dollars associated with tranche 2, but also notified that that would be an amount of $9 million, to give you just a sense of how we are not only stretched, we're prepared, and we're doing everything that needs to be done. But at the end of the day, it has a direct impact on the operational budget and expenses of the city of New Orleans as we're moving through, again, a pandemic. Another issue, and one that we'll continue to remain focused on, is the fact that we are in the heightened point of hurricane season. It is in no way declining, and I believe that as you see the storms that are out there now, it's clearly showing us we're in the height of hurricane season, which means that we need to ensure that we're augmenting our processes and procedures on the ground in the city of New Orleans should I have to call an emergency evacuation, understanding that I have an additional 10,000 residents in my care that I will get to safe ground, but cannot do it alone. And this is why the partnership with the state of Louisiana is vital, and particularly as we, as a city, have stood up across the board to render quality services to our evacuees and to the state of Louisiana. Again, this has been a partnership with all of my administrative departments for the most part, but I tell you, our Office of Homeland Security and the Department of Health have been front and center. I want to thank my city council partners, specifically Councilwoman Helena Moreno and her staff. They have just been essential working with Homeland Security on the ground with resources, and I just cannot overstate that need is such, it's a great need, but it is gratifying to know that we're meeting it every step of the way, particularly as we can respond. So I'm going to now ask Colin Arnold to come up and give you an update, and we'll hear, followed by Colin, we'll hear from Dr. Jennifer Avegno, and then, of course, I will remain with you for questions and answers at that particular time. So thank you again, and Mr. Colin Arnold.
Thank you, Madam Mayor. So, just as a brief update, we have about 9,601 people in town, a few more than a few hours ago, 35 hotels. I will say the goal now, working with the state and DCFS, is as we can, as they can, they're going to start attempting to maybe consolidate some of these hotels as more rooms become available. We have people pretty spread out through many different properties throughout the city. Also, the American Red Cross is coming in and starting to take over the shelter management of some of these hotels from DCFS, and that is a work in progress. They're doing some shadowing in about 10 hotels this morning, and then by this evening they'll be ready to take over those 10 hotels. What does that do? That frees up DCFS personnel to further help with the other properties that are still in play here and then also around the state. So that's kind of where we're at. We have, the state has indicated they've activated their surge ambulance contract with at least 30 ambulances at this point that will be coming into the city, and they will be stationed at these hotels. They will provide direct emergency medical support to the hotels, which is a good thing. As the mayor said, we've been taking on a lot of this as a city with our EMS crews, up to 72, 80 calls over the last few days, and we want to make sure that we're able to provide the normal operations that we provide for our city services, as well as provide that extra surge support for the hotels that have evacuees in them. Again, 9,600 at this point. So again, we're still operating here with the resource center, and that's going to continue through Friday, 10 to 2. We have RTA bus bridge that is running Canal, Loyola, Poydras, and Convention Center that can pick people up if they need a ride down here. It's free. People have been utilizing it. We've been doing a lot of good work in here. We are still asking for donations. I will say United Way is going to cease receiving donations at the end of the day. The Junior League of New Orleans will continue to receive donations, and in particular right now, they're asking for diapers, formula, and feminine products. That seems to be a great need. And so if people in our community that hear this can get with the Junior League and donate some of those items, that would be great. You can find out about a lot of the different donation mechanisms that we have at ready.nola.gov. Again, if you're from Lake Charles and from the affected area and you're here in our city, you are welcome. And we want to say, please text Welcome NOLA to 888-777, and we'll give you updates specific to your sheltering and your visit here in our city. And we want to make sure that you're getting the latest and greatest message that we can give. Other than that, we continue to stay activated in the city's Emergency Operations Center in support of DCFS, the Department of Health. We've got the National Guard, the State Police, as well as all of our own public safety entities there. We have the Red Cross there. We have the Surge Ambulance Contract, AMR. They are up there now as well. So we have a good communications front there and able to coordinate together and respond to what is a very unique situation. You know, when we talked a little yesterday about sheltering, congregate sheltering. You can kind of center your assets, you can focus your resources, you can right size your shelter staff. This is a different scenario. When you're at 35 hotels around the city and in Jefferson Parish, there's a lot of coordination that needs to go into this, and that's what we're trying to do right now. So that is the report that I have for right now, and I'd ask Dr. Jennifer Vegno to come up and discuss the health side of what we're doing right now. Thanks.
Thanks, everybody. There are several of us here in the Resource Center today who are medical professionals in this building when it was the only functional medical facility in the city 15 years ago and provided care. So I think for all of us personally and professionally, it's incredibly meaningful to be able to provide those services once again to our Louisiana neighbors. We have seen, yesterday we saw at least 400 individuals come through. Today we have seen that in 3 hours, so we expect that number to be high. So the needs are great, and we are really pleased to be able to meet them as much as we can. We have partners from LCMC Health as well as Metropolitan Human Services District that are providing on-site counseling, medical assistance, providers on site, prescription assistance. We have Walgreens and CVS here on site. We also have a host of our social service partners, Catholic Charities, Southeast Legal, and donations from United Way, Junior League, multiple volunteers from everywhere you can imagine, from multiple departments at the city. We are very proud to partner with Louisiana Department of Health and other state agencies to make this happen. It is filling a critical need. We want everyone who is in need of these services, who is visiting from Lake Charles, to come. Even if you don't remember what your prescriptions are or necessarily know what you need, we have a lot of trained professionals here who can help. And it's our honor to serve. As Colin said, we will be open 10 to 2 for the rest of this week. And so we encourage everyone to come by. Thank you.
Thank you, Dr. Vegno, and thank you, Colin. And so at this time, we'll be open for any questions that you may have. Ms. LaToya?
Mayor, you did talk about it is an additional financial burden on the city. Is there a dollar amount yet, or is it too soon to talk about the extra money that's costing the city right now?
I will say that it is too soon to talk about the dollar amount associated with the overall response to Laura. Make no mistake about it, we're documenting every step of the way. But I tell you, it just puts an added strain, understanding that being in the midst of a pandemic, being in the midst of not receiving adequate resources from the state of Louisiana as it relates to those CARES Act dollars that the state has received. Okay, and the city has submitted reporting as indicated by the process every step of the way. We were one of the first parishes actually to submit and been ahead of the game on that. But I tell you, it is absolutely concerning that the city of New Orleans has only received $43 million out of over $88 million that has been requested and, of course, documented. And so when we think about those tranches, even as it relates to tranche 3, right now, even as 2, based on what was submitted, I'm out of not even getting $33 million. But when I even look at tranche 2, well, parishes have not been given the information about what that formula will look like. So again, we're responding as this city will always do. We're welcoming, we're loving, we get the job done, we face challenges head on, but at the end of the day, we document, we know what we spend, what our burn rate is, and right now, my focus is clearly on getting the resources that are due to this city, as well as asking for the state to look at that formula to ensure that the city of New Orleans truly gets her fair share, not overlooking the fact that dollars were redirected and diluted. Okay, and regardless of the $800 million going to $500 million, even with the $500 million getting to municipalities, we're not getting our fair share. The city of New Orleans is one of them that has been on the forefront fighting this pandemic, the best in the nation, in my opinion, and it's actually not just my opinion, it's documented as it relates to our testing ability, bringing that peak down 94%, and where we are and where we're going in this city. The future is bright, but not so bright when we don't have the resources to fully operate, and particularly when I have every single city department every single city department making a 20% cut to their budget. So this is real. It's not a joke. It's not a show. But we're going to do our best work all the time. But at the end of the day, it does cost, and we want to make sure that we're whole in not only responding, but based on the needs of this pandemic right now, and of course, in the midst of hurricane season.
WDSU. Why do you think that the city hasn't received the funds applied for? What comes next?
Well, you know what? This is a formula, and the process that is being administered by the state of Louisiana through the governor's office as relates to the CARES Act dollars allocated towards municipalities. I think on the front end of determining that formula, it was and now really in hindsight, understanding that our entire state has been impacted and inundated by this pandemic. Initially, when the resources were received, you know, New Orleans was the hot spot. We did the work, we turned it around, and, you know, now seem to be penalized for doing that work, but we haven't received our money. And I'm feeling like Jerry Maguire, you know, with, what's his name, Cuba Gooding Jr. And he just said, show me the money. That's kind of like where I am right now.
The advocate?
A number of questions. One, do you all know how long the evacuees are going to be allowed to stay in New Orleans? I assume that's being covered by DCFS.
Well, a direct timeline, one, has not been given because of the scale of damage in our neighboring parishes. So we're going to be, we're going to be prepared and will render whatever service, however long it takes, to ensure, you know, that our people, our evacuees, you know, get what they need until they're able to return home. So there will be no thought of saying, hey, not my city, or hey, the time is up. That's not going to come from our city, but what will come is continuing to push for the resources that are needed on the ground to respond to the needs of our evacuees and basic city services that our residents depend on every single day.
And also, I wonder if you all could talk a little bit more about what the ambulances that are being surged in are going to do. And generally, everyone's been talking about the need for more direct assistance for the people who were evacuated. I think you all said, diapers and clothes, things like that. Have there been issues with getting people supplies or getting them what they need? What's the process for addressing that?
Sure. So on the front, I'm going to let my folks also speak to this, but on the front end, the need for additional support in terms of ambulance services are definitely a need. We've indicated that our own EMS has responded to over 80 calls. Again, this is in addition to supplying, and providing services to residents throughout the city of New Orleans. This is a need, and we need to fill that gap to ensure that we do not, overextend the people that have been working and on the ground throughout the past 6 months, responding daily. But absolutely, when you have an additional 10,000 people, we want to make sure that, again, the evacuees get the services that they deserve while they're here, and that means additional manpower. And so I understand by this afternoon or evening, those additional units will be arriving in the city of New Orleans. As it relates to supplies, I believe you mentioned, Junior League and even United Way were activated on the very front end of this through our Office of Homeland Security and working with our volunteer coordinator, Lila Darwish. But I will ask Dr. Vagno or Colin, who may want to comment more on the supplies and the process of that. Yeah, thank you.
So to hit on the ambulances, it's important that we have this ability. The state is bringing in these surge ambulances. It provides basic medical care, EMTs and paramedics at every site. So what does that do? It really is boots on the ground at the location, so they can address these things right away, so it doesn't become an issue of calling for a city ambulance that may not be needed. This may be something that can be addressed very, very quickly, and it's the best way to conserve and utilize resources that we have, which obviously are finite. So that ability to have those extra ambulances is crucial, especially when, like I'm saying, everything's kind of spread out with this sheltering. So it's going to provide kind of a level of care, I think, that will be in the hotels. Also, the state has activated their personal attendant contract, so they will have some actually just more like LPNs available in these hotels to assist as well. So it's trying to just do a good medical assessment and really get a baseline of care that we can provide to everyone in all of these hospitals. And Jen might be able to talk about that. As far as benefits, obviously the discussion about state benefits as far as like programs like SNAP and then also the federal benefits, I encourage everyone who's here visiting, who is here sheltered right now in the city, to visit disasterassistance.org and get registered with FEMA. The 5 parishes in the West have been approved for individual assistance by FEMA. The city does not control that. We're not issuing that here. There's no real financial benefit going on here. This is essential needs that we're providing at a resource center like this, which, to your question, is shampoo, clothes. Some people came here post-storm with the clothes they had on their back. Some people didn't have shoes. Nobody had toiletries, medications, those types of things. That's what we're trying to do here to make sure that that is being addressed. Now, Jen, do you want to talk about the medical side in the hotels a little bit?
Yeah, again, it's just another layer of support. You know, our local hospitals have also really stepped up in terms of not only taking transfers from hospitals in the Lake Charles area that had to shut down after the storm, but also in meeting the needs of individuals who evacuated here and then had to be had medical issues that were sort of beyond the control of what could be handled. So the personal care assistance as well as the additional EMS personnel in those sites are just another layer to make sure we don't have any tragedies in the hotel as much as is in anybody's control. One thing I did fail to mention that I should mention is our partners at the National Guard are doing COVID testing inside the resource center, so that when you come through, if you want, and we're encouraging everyone to get tested. So that's another service that's available here medically.
Thank you.
COVID testing, with the latest numbers in New Orleans has increased with 59 cases, is there any concern as far as this massive influx of people for any kind of spread?
Of course there's a concern. We want to continue to stay on the right track, right? That's our goal, our priority, getting our kids back into the classroom, ensuring that, you know, parents have a safe place for their kids to go and learn, in addition to getting back to work. So it is a priority and it is a concern, but we meet the concern with resources, and that means adequate testing set up here at this location, again, so our evacuees are one, getting the services that they need and understanding that, you know, if they're positive or not, giving them a, you know, a sense of security, knowing that they're okay. And so we are wanting to increase, actually, the level of testing and the scale throughout the city as relates to our evacuees. So again, so that we can continue to be on that path that takes us to a greater public health outcomes. Dr. Vegno, anything you need to add?
We're working with LDH to sort of interpret the numbers that we're getting this week, because we do expect them to be a little bit disrupted, since most of the testing, not only here but around the state, didn't happen to the same capacity last week. We know there was a backlog yesterday, and so we're trying to make sure we understand what the numbers mean. But we do know that the region where our evacuees came from was a region that had some fairly high percent or incidence of COVID. And that's why not only are we, is it important for us to offer the testing, but we also are making sure that everyone has masks and hand sanitizer. So even if you evacuated and you didn't grab your stash of masks, we want to make sure that you are as protected here as our residents are.
All right, the applicant again, well, do you have anything?
Already answered.
Okay.
And a quick follow-up on that, actually. There was some talk last week about providing testing at the hotels themselves rather than here. And I'm curious whether that is still in the works.
We're working through that, but We do know that some hotels don't want to kind of take that on, and so that was one of the reasons why creating this resource center, that point, that neutral space, that our evacuees can come and get tested. But just as Dr. Vegno mentioned, this is very much a work in progress, but a priority to ensure that our evacuees are healthy, and of course, the city of New Orleans remains on that path of being more healthier than ever.
Do you or does Dr. Vegno have any comment on Jefferson Parish's request to allow different regions to open up ahead of the state, and obviously the implications of Jefferson wants to?
Yeah, I really have not, I guess, kind of focused or allowed, I didn't listen, I don't know. I saw something on the news before coming here, a little flash, but I haven't had the time to really download what their requests are. So I really can't comment on that. What I will say is that we, this city, this parish, who is leading the state of Louisiana as it relates to the response, and of course the positive turn and track that we're on, we want to stay on that track. And so our priority remains getting our kids back into the